Welcome to today's video on the levels of prevention in public health dentistry. In this video, we will explore the three stages of prevention: primary, secondary, and tertiary. Firstly, let's discuss primary prevention. This stage focuses on preventing the occurrence of diseases before they manifest. Primary prevention involves identifying and addressing risk factors associated with oral diseases. It can be achieved through health promotion programs and the adoption of specific protective measures. By implementing effective oral hygiene practices, promoting healthy dietary habits, and encouraging regular dental checkups, we can significantly reduce the risk of oral diseases. Moving on to secondary prevention. This level comes into play when a disease has already manifested but has not progressed to a disabling stage. The primary goal of secondary prevention is early diagnosis and prompt treatment. By detecting oral diseases at an early stage, we can effectively intervene and prevent further progression. Regular dental screenings, diagnostic tests, and timely treatment interventions are essential components of secondary prevention. Lastly, we have tertiary prevention, which becomes necessary when a disease has progressed to a disabling or chronic stage. At this level, the focus shifts to limiting disability and improving the overall quality of life for individuals affected by oral diseases. Tertiary prevention includes strategies for managing and rehabilitating individuals with advanced oral health conditions. Through specialized treatment, restorative procedures, and rehabilitation services, we aim to minimize the impact of the disease and restore oral health functionality as much as possible. This was a brief revision about the terms we have already studied. A very commonly asked question, as a short note, emphasizes on explaining the various levels of prevention for dental caries, periodontal diseases, and oral cancer. Through this video, we will learn by making a comparison so that you can retain these points later. Before moving ahead, remember that prevention can not only be carried out by a dental professional in a clinical setup, but can also be done by an individual on their own, or at the community level by various means, for example, awareness campaigns, etc. Let us first discuss the services provided by the individual. In case they want to prevent periodontal disease or oral cancer, the individual can take health promotive measures like making periodic visits to the dental office and demanding preventive services. Alongside these, for the prevention of dental caries, diet planning is also considered a health promotive initiative. While specific protection against periodontal disease could include maintaining proper oral hygiene practices, for oral cancer, avoiding known irritants like tobacco is considered a specific measure. For the primary prevention of caries on a personal level, specific measures like using fluoridated dentifrices and consuming fluoridated water, along with having good oral hygiene habits, are necessary. Secondary prevention for all three conditions includes self-examination and referral, along with proper utilization of dental services. This will ensure early diagnosis and prompt treatment of the condition. In cases where a disability has occurred, for example, the lips are completely affected by oral cancer, utilization of dental services by the individual is necessary to limit this disability. The same is the case with periodontal diseases and dental caries. Utilization of dental services is also equally important for rehabilitation in all three cases. Moving on, we will now discuss the services which are provided by the community. For primary prevention, health programs where people are educated about dental health as well as the importance of research and its efforts are promoted, account for the health promotion in all three cases. Under specific protection for the prevention of periodontal diseases, the community should make oral hygiene aids available alongside organizing supervised school brushing programs. For oral cancer, like an individual, a community as a whole should avoid irritants causing it, like tobacco. Specific programs organized by the community like school water fluoridation, school fluoride mountains, and fluoride tablet programs, as well as school sealant programs, are some of the methods to prevent dental caries at the primary level. Talking of secondary prevention, we all know how important it is to diagnose a condition like cancer, caries, or gum problem as early as possible. The community must organize periodic screening and referral programs, and also make the people aware of the various provision of dental services that they can make use of. Even for tertiary prevention of these conditions, community officials must make the public aware of their rights to make use of the provision of dental services to limit the disability that occurred, as well as for rehabilitative purposes. Lastly, we will now discuss how a dental professional can help with the prevention of these diseases at different levels. Taking oral cancer first, the dentist can promote the health of the patient by educating them about oral cancer and its causes, alongside trying to help them get rid of their addiction. This removal of irritants is the specific protection against cancer. Now, if the cancerous lesion has occurred, the dentist should immediately go for secondary preventive measures and do a complete and thorough examination, aided with biopsy results. If required, prompt treatment could also include complete excision of the lesion. If the dentist comes across a patient long after the cancerous lesion occurred, to limit the disability, he should immediately begin with chemotherapy, radiotherapy, or surgery, depending on the case. Once the disability has been limited, rehabilitation is necessary. This could be done with the help of plastic surgery or speech therapy, along with maxillofacial and removable prosthodontic prosthesis to replace the missing parts. In the case of periodontal disease, similar to oral cancer, the dentist can primarily educate the patient about proper brushing and flossing techniques and recall them at regular intervals to ensure reinforcement. Specific protection here would include organizing plaque control programs, correcting malaligned teeth to avoid food getting stuck, or something as basic as routine dental cleaning as a prophylactic measure. In case a periodontal disease has surfaced, the dentist must examine the case completely and choose to do curettage or corrective restorations as deemed necessary. If the disease goes undetected to a level where it has caused a disability, it is a sign for the dentist to immediately start with the tertiary preventive measures. These include deep curettage, root planing, along with splinting if the teeth are up to grade 2 mobile. There may also be cases where surgical interventions may be needed, including periodontal surgery, as well as extraction of certain extremely mobile teeth. This is then followed by the placement of removable and fixed partial dentures, as well as the correction of minor tooth movement as a part of rehabilitation. Finally, talking about dental caries, a dentist can prevent it primarily by not only educating the patient about its cause and prevention, but also counseling them about their diet, which should contain less sugar and carbohydrates. Plaque control programs can also be introduced. The patient must be recalled at proper intervals to ensure reinforcement. We know fluoride has properties which prevent caries from occurring. Thus, primarily, specific protection could include topical application of fluoride and fluoride supplements. Additionally, pit and fissure sealants can be placed in teeth with deep grooves and fissures. If the dentist feels the need to confirm if a lesion is carious or not, there are also several chair-side caries activity tests available. Once detected, the dentist should completely examine the lesion, followed by any one of the secondary preventive measures to promptly treat the lesion. This could include promptly treating the incipient lesion or using the technique of preventive resin restoration, the concept of which we will learn in the coming videos. If the carious lesion is small, we could also go for simple restorative procedures. In case the pulpal floor is exposed or on the verge of being exposed, pulp capping can also be done. If the lesion has been left untreated for a long time, it can lead to severe conditions which need to be limited. It can be done with the help of complex restorative procedures or root canal treatment. In severe cases, extraction of the affected tooth is recommended. The rehabilitative measures for these could include subjecting the patient to removable or fixed prosthodontics, implants, and correction of minor tooth movements. In conclusion, prevention of a condition can be done in 3 levels: primary, secondary, and tertiary. It can be done either by an individual, a community, or the dentist. The sooner a condition is predicted and detected, the better. As we know, prevention is better than cure. We have now come to the end of this video. We hope you had fun learning with us. Think out of the box. Explore more such videos on our website.